Are you ready? Let's do this!
Hi, everyone. I want to welcome everybody back to my YouTube channel, to our YouTube channel, The Gold Corner, spreading childhood cancer awareness. This week, I have a very special family here that we're going to be speaking to and hearing their story. Special, why? Because they are from my home state of New Mexico. Yes, green chili. You know, so I just wanted to go ahead and just say thank you. I want to thank everybody first and foremost for tuning in, for showing all the love and support, and to be able to hear the stories of these little warriors that have gone through this or are currently going through this. Um, it's something very dear to me. It's something very dear to the parents. And when we tell the stories, we're spreading awareness and we're speaking about our warriors, what they have gone through, what they're going through, and to let people know that childhood cancer is not as rare as they think. So again, just I want to thank everybody for their love and support, for subscribing, for sharing these videos, and just for supporting all the families that are represented here. Once again, I have Juliana and Gabe. I have him here. So again, they are from Rio Rancho, New Mexico. I've been to Rio Rancho so many times to ref up there at the Santa Ana Star Center. I love going up there. My best friend lives up there. So I'm up there quite a bit. Juliana reached out to me in the Neuroblastoma group that we're a part of for, the support for the parents. And we got to talking. They actually sent me a very, very cool license plate that they had made and that the state of New Mexico passed, and it's for childhood cancer awareness. So if you're watching this and you're from New Mexico, maybe you would like to talk to them and see how you can get one of these license plates, which is pretty cool. We're going to be hearing their story, and we're going to be hearing the story of little warrior Taliana, or Tali as they call her. She, of course, a little girl, and her parents are going to be speaking more in depth about this, but same cancer that my daughter Mia had, neuroblastoma. So we're going to be hearing her story, what she's going through, the treatments, and once again, to let you guys inside, to a little bit more on the inside of what happens here, from listening from the parents and what they're having to go through, as far as everything and how it's affected them, how it affects just the whole family in its entirety. So once again, thank you all for tuning in. And Juliana and Gabe, thank you very much for being a part of this. Thank you so much for coming out and for telling us your story. We're looking forward to hearing about this, about your little warrior that you have that is currently fighting. So if you can all introduce yourselves, and we want to hear this great story.
Well, thanks for having us. I'm Gabe Vargas, wife Juliana Vargas.
Yeah, thank you so much. And thank you for everything you're doing to spread awareness. It's so important. It really gives a candid view of from the inside, and and shows a different side of it that we don't always share. And like I said, thank you for including the dads. It's very important to recognize how much you guys are a part of the journey and how much we appreciate you.
Well, thank you. Yeah, it's it's one thing that I've gotten a lot of messages from dads and saying thank you for showing the father side of these things, and moms. I love you, moms, because of everything that you guys go through and everything you guys endure. But there's also a second parent in most cases, or at least there should be a second parent in most cases, and that's the dad side of it. But yeah, and you will get into that a little bit further, and I'll ask Gabe to kind of give me a little, to give people and families and dads advice here. But if you guys want to talk to us about your warrior, as far as when she first got diagnosed, her age, and all of that, we would love to hear that.
So she's now 12 years old. Just turned 12 last Monday, actually. So last year before the teenager. Been dreading that one for a little bit. Actually, not quite excited. It really started about December of 2017. A lot of back pain here and there, stomach aches, just weird little symptoms. Never would have thought much of it. Took her to the doctor at least once every 2 months. Had x-rays done, you know, and of course when you go see the doctor, it's someone else, a nurse practitioner. You see the actual doctor or whatnot. You know, we have, oh, your back's hurting, do stretches. Try these workouts. Oh, it's just a tummy ache. You know, it's just always something. They never really do look into the whole big picture, see if something's going on. About April, I believe, she had her teeth extracted, getting ready for braces. Some overcrowding, so they go and extract some teeth. The very next day, her lymph nodes swell up. Two right here, just bean shaped, very hot to the touch, red. So we call the doctor. Her orthodontist, actually, we called, and she recommended we go to the oral surgeon. The oral surgeon gets us into the office the next day and says, well, this definitely isn't from anything I did. Just pacified it. Maybe you should go see a doctor. But it's not from nothing I did. So, move on. We go see her primary physician. They do strep test. And sure enough, comes back positive. So they think, well, it's just strep. If anything, here's some antibiotics. If anything doesn't go away, you know, come back and see us. So symptoms don't really get better. 2 weeks later, still has the lymph nodes. And I think I need to back up there for a minute. At one of these appointments, the doctor actually does run some labs, tries being thorough, and they saw something weird in the urine. We didn't know what it was at the time, so he just does a verbal consult with a oncologist at UNM that he knows. And he says, it doesn't look like anything, give it 6 months and come back to me.
If it's still,
Yeah.
if the lymph nodes are still swollen, we'll check you out in 6 months, is what they originally told us.
Yeah. So, trust your doctors, right? They're the professionals. So 2-3 weeks later, we go and her lymph nodes are still there, still, you know, hurting. It was about July by then, right?
No, in June we had taken her for the back pain. She was waking up in the middle of the night and she'd come to my side of the bed just sobbing and saying, my back hurts, it hurts so much. And I'd give her Tylenol and I'd lay her next to me and kind of soothe her enough to calm her down to where she could get back to sleep. So we took her to the doctor because the back pain was persistent. It just happened so many times that I said, let's take her back, let's check it out. And they handed us a paper with just some stretches to do and send us on our way. And then in July, it's crazy to look back at photos now of the time period because she was so thin. You see her clothes are just so baggy on her, and she was telling us that she'd have a tickle in her throat, and so when she would eat, the food wouldn't stay down, it would come back out, and she could keep some food down, but she said, I don't feel like I'm nauseous, I just have this tickle in my throat and the food comes back up.
Just a gagging feeling.
Yeah. So we took her back and they prescribed some anti-nausea meds and said, well, we can run some more blood work. And I said, well, I've been looking up these symptoms on the web because that's what you do when you are a parent and you can't figure out what's wrong. And I said, her symptoms are anything from like a gluten allergy to non-Hodgkin's lymphoma. And I said, so when you run those blood panels, can you run it for everything and anything you can think of? Because we need to figure this out. So the gal that we had taken her in to see, she did the blood, and that was a Saturday, I think.
Hmm.
And so we took the blood, and
So, long week, weird week. Just relived it because last week was 2 years from this. Sunday, I go out to your neck of the woods, go to Las Cruces for um, work, for training actually for a week. So leave her here to deal with this. It was
Tuesday.
Monday. Monday, they called with the blood work results, and they said, and this is her primary doctor at this point, said, we need to get her in and do an x ray. We need to be sure. Some of these things just look off.
Yeah, so at that time, Tolly and her younger sister were in a summer rec program, and so they went to the summer program that day, and I was working from home, so I told Gabe, he was there and I was at home, and I said, well, I don't know when I can take her for the x-ray. I'll try to see if I can go tomorrow. And he checked our local radiology department and said, well, they're open late. Why don't you take her tonight? So I got off work. I picked up Talia and her sister from the summer program, and we went to do the x-ray. And so my girls are sitting in the waiting room playing like sisters do, jumping around,
taking pictures.
Yeah, taking photos. You couldn't tell that there was anything wrong beyond her weight loss and things that we knew were going on at home, like the vomiting. And so so I took her to the x-ray, and I'm standing behind the screen with the technician, and he looks over at me and he says, you need to get her to an ER right now. She's got pneumonia or something, and there's just this big cloud in her chest. You couldn't see through it at all. So I asked him, will you please make copies of the images, so if I do go to the ER, I'll already have these images with me, and we won't have to wait there for someone to, wait for them to be reviewed or looked at. So I left there and I called Gabe and I said, do you think I should trust this person? Should I take her to the ER? She looks fine. I don't understand what's going on. And he said, well, drive to the pediatrician's office and discuss it with him, show him the x-rays. So I got to the pediatrician's office and I said, I'd like to speak with her physician. And the front desk gal said, she said, they already called with your results and spoke to the doctor. Just go ahead and go home and wait. So I put my girls in the car and tried to keep a straight face. And a few minutes later, I got a call from her physician that said, there's a room for Tolly downtown. Get her there now. So I didn't want her to worry. And so I called my mom and my sister and anybody to see if I could get a hold of someone to watch my younger daughter so she didn't have to, go with us and be scared and be bored. Because I didn't know what to expect once we got there. I didn't know where we were going or what was happening. So I brought the girls home and I had them each pack a bag, and I said, we're just gonna go to the hospital and we might spend the night. I don't know what they're gonna have us do. So pack a bag and let's go. So I went and I got a hold of my sister, and she watched my younger daughter, and Talia and I we went downtown, and we went up to the 6th floor, and we picked up the red phone for the unit and said, "We're here. You should be expecting us." And we walked into the most happy face nurse. She was so welcoming, and she said, "You're family now, so come on in, let's get you settled." And we sat down, and they started going through images. They started running tests. From the time we got there, it was just nonstop wait and labs. They were running labs constantly, blood draws.
I missed all this part. I'm currently on the freeway.
Yeah, he's
coming
driving
back from
100
Cruces.
miles an hour from Cruces trying to get there because he called the pediatrician and said, "Do I need to be there?" And the pediatrician said, "You better get home. You need to be home now, like now." So they initially treated her with a chemo because they weren't sure what the problem was. So they just gave her a chemo, and they said, "This chemo we're giving her should shrink the mass that's in her chest, covering her whole chest, by at least half within 24 hours." So we said, okay. And after that 24 hours, it didn't move. That mass it didn't care. It didn't care about the chemo. And so we said, well, let's try another one. And the second day, she got a different chemo. And
Steroid.
was it a
They
steroid?
moved to a steroid because she was a little grumpy. That was the meanest I've ever seen that little girl. She's the sweetest little girl ever, but she was mean to me that day.
And she
They thought it was lymphoma.
they thought it was
They were treating it.
leukemia or lymphoma. They just weren't sure. So they told us we have a very small window to get in and get the information we need. And the tumor was so large, it was so massive, and it was sitting right on her lungs. And they said, we can't put her to sleep, but we need a biopsy. We need to figure out what we're dealing with so we know what to give her. And so they couldn't sedate her, and she got a PICC line installed with no anesthesia, no nothing. They put it straight in her arm and all the way to her heart.
Still the worst, screaming.
And we were just sitting outside listening, and they had the crash cart ready just in case it collapsed and just smashed her airways. And so
this is day 2.
This is day 2. Filled with x-rays and everything, still monitoring with labs. So they got that in, and they said, well, now that she has a PICC line, we can give her more medication to help with pain or with nausea or whatever she needs with this PICC line. It'll help. So they gave her that, and then after that, they were able to come up with a plan so they could partially sedate her and let her breathe on her own enough to get the biopsy. So the first biopsy was cut. They cut the lymph nodes out that were protruding in her shoulder. And they told us it was a blue cell tumor, and that's all they knew so far. That was the immediate result. So Gabe and I are sitting on the hallway floor at the hospital, just staring at the operating room doors, waiting for them to come out and tell us what was going on. So once that was done, we went back up to her room and we sat with her, and she celebrated her 10th birthday at the hospital. the nurses got her these gigantic cookies, and they brought her little teddy bears and things, and it was hard. So
She was really looking forward to that birthday.
she wanted to do science fair projects with her friends there.
She's excited for double digits.
Yeah.
No idea why.
That first
Her birthday was a Friday.
Yeah.
So the weekend was a waiting game. Nothing but waiting. Just no treatment anymore. No, she was on chemo.
Yeah.
They still kept her on chemo just in case.
They kept it going. That first day was 37 days. 37 days inpatient. She had fluid building up in her chest, so they took her to surgery again and put in a chest tube to drain the liquid out of her chest. And that was probably the second hardest day we had after, diagnosis, I guess, was after that, the following Monday. It's hard to think of the timeline. I mean, because those first days you're walking around the hallways with a blank stare on your face. You don't know whether to cry or be angry, or you have so many thoughts. Why did this happen? What's going on? And the following Monday, we were a mess. We didn't know what they were going to tell us in the meeting. We had a little idea when we were going to the diagnosis.
You can't give parents 3 days with Google and a blue cell tumor to figure out what it is. It's just too much guessing. So, I mean, we had a good idea, but we did a lot of bad research at that point.
So we went in and they discussed with us. I was watching your video from last week, and it hit close to home because there was so many things that they spoke about that were very similar to Tali's treatment, as far as I just noticed so many similarities. So talking or hearing other parents' stories, it makes you remember those days. Did we tell you about her PICC line?
Yes, that they actually started the PICC line with no sedation or anything. Well,
right. Yeah, so they got that in, and they were able to give her medications for her to biopsy her tumor. And then we waited the weekend, and the following Monday was the day they gave us her diagnosis.
And so the day of her biopsy, they told us it's a blue cell tumor. That's all we could tell right now. The slides are being reviewed. And of course, over the weekend, you're not going to get as much information. So Friday was her birthday, made the best of it that we could. The nurses, always amazing. Oncology nurses are just a different breed. There's no other way to put it, because they make you feel special in the worst times. So we celebrated her birthday that weekend, tried to relax as best as you can and just wait. And Monday, they called us over to a little conference room in the corner of the PICU, and had the social worker,
nurse
navigator, and two oncologists. And they told us she has stage 4 high risk neuroblastoma. They still didn't know whether it was amplified or whether other aspects of neuroblastoma that are there. And they just gave us the rundown. They told us it's an 18-month treatment protocol. If everything goes okay, and stays on time. It's 18 months. They said it would be, and this is the original protocol they put us on, but it would be 6 24-day rounds of high dose chemotherapy. After the 4th round, we would be traveling to Colorado to remove the tumor, have surgery in Colorado. And actually, after the 2nd round, she had to go to Colorado to do her stem cell harvest for when she would have her stem cell transplant. And originally, it was supposed to be 6, and we were supposed to go have stem cell transplant after the 6th round. Following that would be radiation. Following that would be immunotherapy. So they're trying their best, give us the rundown, what the future looks like and whatnot. And we were pretty solid. We were rocks for a little bit until got choked up when they said that she wouldn't go to school.
She loves school.
You always see the commercials of the kids running around, you know, oh, I'm in treatment, but I still go to school. I'm still happy. And so we thought, okay, you know, we'll have to be safe. Well, they said very point blank she was not going to be in school the next year, at least. But I broke down when they said that she probably won't have kids naturally.
She loves
She won't.
children. She loves all kids, but she's got a big heart for the little ones. And that was a tough blow beyond the obvious diagnosis, but just to hear that she wouldn't be able to have kids naturally was.
And she was hard. Too young, and treatment had to start the next morning, so there was no way to stop and try and harvest eggs or anything like that. There was just zero possibility. So we left that meeting, and we said we need to go down to the cafeteria and have a talk and figure out what, you know, at least the next week's going to look like, jobs, you know, what we're going to do, and how we're going to tell Tali. We didn't know how we were going to tell Tali. So we go back to the room, walk in, and she looks right at us and says, do I have cancer? And take a breath and say yes. She says, am I going to die? Very easily we say, no, we're going to fight. We got this. So, okay. Went back to watching TV. She took care of that conversation that we were going to have.
We were terrified to tell her, and with her little innocence, she just wanted to know. And after that, we kind of said, okay, well, now what?
Let's still go to the cafeteria and figure out the rest of the stuff.
Yeah, so we did, and everything just was just a roller coaster. That first 37 days she was inpatient. She did her first round of chemo, and she wasn't well enough to go home. She had a chest tube in to drain fluid from her chest. So they went ahead and started the 2nd round of chemo. But during that time, one night she had this really amazing nurse who came in, and within half an hour of her shift, she just noticed that Tali wasn't herself. And very quickly she got us down, and Tali had a CT, and she said, I want to figure out what's going on, what we need to do to treat it. And so her, along with the PICU doctor that was on that night, they decided to use what's called TPA, which is it clears out blood clots from the central line. But it wasn't going in her line, it was going into her body, and it was supposed to move around, so it burned her whole insides. And we were supposed to move her to get it everywhere it needed to go, and she was in so much pain. It was just awful. And they left it in her for a few minutes and then drained it out, and it seemed to make a little progress. And so they moved her to the PICU from regular oncology area. We stayed there for the remainder of that week, I think. But even then, they kept trying to use the TPA like every day to clear out these blood clots or fluid or whatever was.
It was creating pockets. She had fluid in her chest cavity, and there's the way they explained it was like pockets of like almost like webbing is how I envision it in my mind. And so they're trying to break that up so the fluid could come out.
So one night he tells me, you go to bed, because at that point I hadn't slept. If you're an oncology parent, you know there is no sleep. You get a wink in here and there, but you're always with one eye open in case you hear a bell going off, in case you hear something out of the ordinary. If they need to get up and go potty, you have to be ready. So he said, you go to bed, I'll stay up late. And in the hospital, there is no comfortable bed. You're sleeping on 1-inch mattresses that have springs in your back. They are really not comfortable. So I slept, and in the middle of the night, I wake up and I hear, and Tali is gasping for air, and so I called her nurse, and she had the TPA in her line at the time, and so the nurse released the TPA. Her numbers calmed down, and I fell asleep at her feet because I was too afraid to go back to my bed and sleep. And again, later on that night, again, she couldn't breathe. And it was just hard. We came very close to losing her several times that first 37 days. So that was through the month of August, and in September we went to Colorado and they harvested her own stem cells. She would be her own donor for her transplant, so they did that, and there's no breaks in chemo treatment either. So once you get back from that, you go straight into your next round of chemo, which we did. And that third round was brutal. It is the worst kind of chemo. It causes high frequency hearing loss, and she wears hearing aids now because of that. It makes him so sick, beyond sick. He and I would take shifts, and she would need medication every 2 hours. So once she came home after that chemo, I would get up, and then he would get up, and then I would get up, and he would, every 2 hours, so she didn't miss any doses of anything to help with the nausea and help with anything we could.
Or I'd be staying up till 3, 4 in the morning, and
I would wake up, or at like 2, and I would
Yeah.
wake up at 2, and I'd take the next shift and stay up so we could each get a little rest. And then in October, they told us we're gonna take her tumor out, and it should be about an 8-hour surgery. And on the day of the surgery, it was about 11 and a half hours, over 11 hours.
Originally they said, we're gonna put a scar on one side of her, it's on her back, and said we should be able to get the tumor off from that side. Well, they come back and say it's too big. We're gonna have to go through both sides. So we're gonna do one side first, get what we can, turn her out, close it up, turn her over, and get the rest. So I want to say it was about a little less than 8 hours just for the first side. And so her tumor, I don't know if you can see me too well, the whole body here, her tumor covered her whole right lung, from her diaphragm pretty much up to her collarbone. It spread, it's kind of thin, and it spread across her heart, wrapped slightly around her aortic artery and behind her other lung. So they were able to get most of it on the right side. And then that's when they turned over, and they had to be extra careful, of course, around the artery. And there was some that weaved its way into her spine. So they were very careful to not hit any of all those nerves and blood vessels that go through the spine and get what they could. And they estimated they got 90 to 94%, am I right? So they said it was successful. In our heads, 94 isn't 100, but they were very pleased with the results. So we wait about half an hour from when they come out and tell us, say, to go to the room and see her and be with her. And that image will never leave my head. The first time you see your kid on a respirator, full of fluid, just puffy, unrecognizable, is hard. And that is one of the reasons why this coronavirus pandemic hits home, because if you've ever seen your kid on a ventilator, you understand why you don't want to be on. She woke up not too long after. She was aware and she knew it, and she was trying to scream, trying to cry, trying to something get our attention. And everyone's trying to talk to her, trying to calm her down. And we know how smart Tali is. She's very smart. And so finally I'm like digging through a backpack and find pen and paper. And I put the pen in her hand and put the paper, and of course she can't see, she's pretty much stuck. And she writes water. All she wanted was some water. And they're like, no, we can't give you water. You won't be able to swallow it. She's still intubated at the time.
She said, how about a dum-dum?
She writes down dum-dum.
Yeah, she wanted a lollipop. She says, I can't breathe.
Her throat is so dry that it's just hurting, like chafed. That's how I imagine it to be. So they gave us these Q-tip looking swabs with liquid on them, and they just have you swab the mouth. And she's like, another. I'm like, we can't. It's brutal. That was a very brutal 3 days that she remained on the ventilator.
She stayed there for a couple of days. They were really hard the first 3 days. They gradually moved her to a full face mask, oxygen, and then the nasal cannula. And then we stayed in the PICU just for that short time, and we went to the regular floor for a couple more days. But we were in Colorado for about a week for the surgery portion of her frontline treatment. Once they gave us the go-ahead to come back home, we went again straight into chemo, the next round. And
it was at that point that they told us the protocol had changed, or they found the updated protocol, whatever happened. But this new protocol was 5 rounds of frontline chemo. Same rounds, we didn't miss anything up. But the new protocol was a tandem stem cell transplant, 2, and instead of 6 rounds with 1 transplant. So this next round that we did after surgery was supposed to be her last one.
So we went to Denver following that final round of regular frontline chemo, and they did a full workup in anticipation of her first transplant. We'd spend a week up there, or maybe a week and a half, 2 weeks, doing the whole workup.
All the blood work you could do, scans,
CT, MIBG,
hearing
MRI,
tests,
yes, everything,
vision.
but the kitchen sink, they do all the tests and labs you can possibly think of. And at the end of that week, he came home because we had talked with all the doctors. We thought, okay, we're jumping into this. And he brought our younger daughter home, and she had to get back to school. He had to get back to work. And I said bye, and they left. And so Tali and I drove to the nearby Dairy Queen, and we got an ice cream. And on the way home, her transplant doctor called and said, "I'm sorry, she still has too much neuroblastoma. We cannot move forward with transplant." And I'm by myself in the car again, trying not to let her be worried. I said, okay, thanks. I'll talk to you soon. And I didn't want her to worry. And I called Gabe and I said, she still has too much. And we moved pretty quickly after that. They decided that they were going to try immunotherapy up front to get rid of more of the neuroblastoma, because it was not just the primary tumor, it was in head to toe bone marrow. It was all of her was full of neuroblastoma.
So for neuroblastoma, there's a thing called a Curie score. It's basically a measure of how much neuroblastoma. At that point, she was a 13. The hope going into transplant was to be under 5. So, we don't know what these mean, 13 versus 5 and how much and whatnot, but obviously it's nowhere close, and it's just concerning. So
I told him, go ahead and go home. I got this round of immunotherapy. How bad can it be out here?
it was immunotherapy with chemo.
Yeah, and at our home hospital, they had come up with this little cocktail of medications that had been working great for Tali. It was to help with her nausea. It was Benadryl, Ativan, and Dexa something. They call it the bad drip. So we requested in Denver, will you please give her the bad drip? Because if it's going to suck, we want to do as much as we can to make her feel as comfortable as possible. After
the first couple rounds, the doctors noticed that Tali is very sensitive to medications. Not allergic, just sensitive. So she needs lower doses more often. Her age and her size didn't really matter. So they're very considerate of that. And that's when they started her on this drip. Colorado was not.
They didn't want to do it. They didn't know how to build it into their system. They said the medications conflicted with one another. It turned into a mess, and what they ended up doing was giving Tali way too much Benadryl as part of it.
And Ativan.
Yeah, more than an adult would even have. And I was sending Gabe photos in the morning when I got up of Tali would projectile vomit all over the room that night. She would have emesis bags full of vomit every 20 minutes. She didn't know where she was, who she was, anything. She was so out of it. That was the hardest after what we had even already been through. So at the end of that week, she finished the immunotherapy, and I said, okay, I'm going to drive home. He said, no, you're too tired. I'm coming to get you. And he drove us home. And we were able to spend the holiday at home that year. And we were so scared we thought we'd be in transplant during Christmas. And to be able to go home, man, I took as many photos as I could. I just tried to memorize every single moment and every single anything we did, anywhere we went. I was just so nervous that was going to be our last Christmas, that was going to be our last anything. It was so scary. And we did scans again after that. We went back out to Colorado the the beginning of January.
Well, let me back up real quick. Thank you, Presbyterian doctors. They had a whole training, brought in a specialist to learn this immunotherapy, just so Tali could come home, do 2 rounds here.
Yeah.
They accommodated just Tali because they were her first. She was their first neuroblastoma patient in so many years.
As a new group, because they had a new team.
So, I mean, they always went above and beyond for us. So, thanks to them, we were able to be home for those times.
Yeah.
And they got us to where we were. So,
they did.
Back to where you were.
We went back up to Colorado. We did scans again, and they said she's still a 3. We think we can do better on the Curie score. Let's do another round of immunotherapy. So by the time we went back to Colorado, she had already done 3 rounds of it. And after the last one, they got her down to a Curie score of 1 and said, okay, we can go ahead and proceed with the first transplant.
They warned us
of
how this transplant would go.
Yeah.
Specifically the first one. She would receive 3 chemotherapies. One specifically to start off with, she would have to be bathed every 4 hours because the chemo seeps through your skin. You don't want to leave that there. It could create burns and whatnot. So
which a lot of patients have experienced, that skin just peels off and burns.
And it's interesting because as we read through the neuroblastoma pages, every hospital seems to be a little different. Some are 4 hours, some are 6. They're all very different. This one was 4. And not just that, they changed the bedding, bleached the mattress every time, bleached everything that she touched.
Changed clothes.
Extremely thorough, and it seems tedious. I can't say it was hard. I wasn't there. Of course, it was hard not to be there, but she did that whole week. The plan was for her to do the first week, and then I would go down, help. Still got to make a living, still have another daughter to take care of, so we're still trying to balance all that.
She was a trooper, though. I'd wake up about 5 minutes before I knew the nurses would come in, so I could wake her up gently, and we'd take her bath, and we'd sing Disney songs while we were taking her bath, and she'd change, and then she'd go back to sleep for the next 6 hours that she could, and she just got through those days. And then at day 0, when she's done with all the chemos for the transplant, these are adult dose chemos. They call them platinum chemos because they are the worst of the worst chemos out there. And on day 0, they said, yay, it's your birthday, you get your stem cells back. And it's pretty uneventful. You get this teeny tiny little bag of cells, and it lasts about 15 minutes. And I said, okay, well, when does she start feeling better? And they said, it's gonna get worse before it gets better. So those first, I want to say 8 days is horrible. The infection fighting cells go down to 0. You're afraid of any germ. You're afraid of anything that could happen. You're watching their stool. You're watching their vomit. You're looking for anything out of the ordinary that could mean infection, any fever, anything. And they get mucositis really bad, and so their inside of their throat just starts peeling off, and big chunks of skin would come out of the inside of her mouth. It was so hard.
And they warned us it'd be bad, but hers was, I don't know if it was extra bad. I can't compare it to anything, but it was basically top to bottom. She had it all the way through. I mean, she'd literally sit there, stick out her tongue, and pull off a piece of tissue right off her tongue, her gums.
Yeah.
Um,
So she finished that, and they let us go back to, it's kind of like a Ronald McDonald house. It's called Brent's Place in Colorado, and they are amazing. They're a place, a home for transplant patients or patients that are going through cancer treatment. They're amazing folks, and they said you can't go home, but you can go to Brent's Place, so you're still close to the hospital because it's right next door. But guess what? You're gonna be a nurse now, Mom. You will be giving her round the clock IV meds. You will be running the TPN for all night long. At the time, Tolly was still really weak, so she had a walker, and we would loop her TPN around her walker in case she had to use the restroom in the middle of the night. So when she did, we'd scoot her little walker, like a little kind that you see with the handles and the seat, and she would push it around. She didn't let it anything stop her. She'd wear the little backpack with the TPN in it if we had to go anywhere. And we talked really in depth about going through with that second transplant because we saw how the first one went, and
we knew the risks of the second one. We've read all about them from parents. I mean, the doctors try and warn you, but they have a certain role to play. You know, us parents in our support groups are very honest and tell the stories, and we've read about VOD and TMA and
the side effects. We read about everything, and we knew what the odds were if we didn't go through the transplant. And so ultimately we made the choice to move forward with it. And so we did, and the second round was worse than the first. At one point we started noticing that she wasn't herself, and we asked at rounds for 3 days straight to test for VOD, to get her the meds for VOD. Something's wrong. She's got this wrong, that wrong. She's not using the bathroom.
She was hallucinating.
Her stomach was so distended you could see the veins just running through it. She wasn't herself. And finally, on the third or fourth day, they said, okay, she has VOD, let's transfer her to the PICU. We don't have the machines that she'll need up here on the transplant floor. She needs one-on-one care. And we went, and during that time her kidneys stopped, her liver stopped.
She went into complete hepatic renal failure. And, you know, she already had a complication of breathing because of the tumor, and her lung capacity was low. So at one point they intubated her. Again,
they tried to drain fluid off of her. They were trying everything, and they told us, you better sit tight, it's a long road. And we weren't sure we were going to make it past that road. And there were some struggles. There were some very hard nights where Gabe said, we're not leaving without our daughter. We're taking her home. We're going to figure out a way. And it was so hard, like just staying positive or hopeful that we were going to not lose her. And they put her on dialysis. They had her on 24-hour dialysis, and every couple days the dialysis machine had to be changed with a brand new circuit. And so they would say, during the change, we're going to challenge her kidneys and see if they'll work for us. Every time they challenged it, she would just swell up again. She would just go back to square one. And
But during those hours of changes, those PICU doctors and nurses were amazing. They, no one usually gets to go outside when you're in the PICU because you're on some type of machinery that requires you to be in the PICU. So during these hours that they're changing machines and whatnot, one nurse actually took us outside, brought us popsicles, threw a tent over Tolly basically with blankets, and we hung out. She got to be in the sunlight.
yeah,
Just kind of relax.
Yeah.
Have an hour or two of not normalcy, but just
fresh air.
less anxiety.
Yeah.
Just
So
there. That was pretty amazing.
it was a long road. She was in the PICU for a month before we went back up to the transplant floor. So she did have full BOD. And then we stayed in the bone marrow transplant floor for longer, and they couldn't get her to stop vomiting. She would throw up everything, and they wanted that to be stable before they allowed us to come back to our home hospital. We tried everything. We tried any medication we could think of, and
Any food, any drink.
yeah, the day they said we could finally go home, they changed their minds and said, no, she's not ready.
One doctor on a Sunday said, you can go home, you guys can leave tomorrow. We were scheduled to start radiation that Thursday. So this doctor made plans for a week trying to get it all ready. And another doctor comes in, it was actually our primary bone marrow doctor, oncologist. And she said, no, you're not going anywhere. We still need to do this. So now, a few more days there, battling. They wanted to do radiation there in Colorado. We said, absolutely not.
No,
We're going home.
I wasn't staying. I
Yeah.
was not staying. I don't care if I have to just take her out myself. I was not staying in Denver any longer. And so when they gave us the go ahead, we came back. It was tough at first. She still struggled. And then we did the 12 rounds of radiation. And we jumped right into immunotherapy. And the day before she was supposed to start immunotherapy, the Children's Oncology Group came out with a new protocol where they were going to remove one of the chemos that makes children really sick, has very difficult long-term effects. And right after she had just gotten well from liver and kidney failure, I wasn't about to take a chance. So I asked them, hey, one of the Neuroblastoma parent pages I follow, they said there's a new protocol. So luckily the doctor took it seriously, and they
Found the study. He read the whole study that night.
Yeah.
Um,
And we started the next day with the appropriate protocol. So she did 5 rounds of immunotherapy, and then Accutane, which is a very strong medication where you have to sign all types of consents. You have to say you're not going to allow your child to get pregnant, even though she's 11. And from there, we went straight into the clinical trial, which she is on currently.
Well, I'm going to back you up real quick. August 9th, right after radiation, we get the news from follow-up scans. She was NED. The transplants and the radiation worked.
That's right.
So, extremely happy. Nurse navigator surprised us with that one.
Yeah.
Yeah. Hi, Kelly. Um, that was some of the best news ever.
Oh my gosh, we all cried. We cried so much. So she's still getting scans now, and it's really difficult because a lot of folks get the impression once frontline treatment is done that it's over, that the child is well and they're back to normal. And Tolly still struggles a lot because of the very strong medications she was on during her treatment. She has gaps in her memory of things that she can't piece together, and she struggles with not remembering things. She struggles with remembering too much. She has flashbacks of the treatments. She has the first, actually, for the last 2 months of her treatment, she would have pretty much full meltdowns every single day, at least one, if not more, where she just didn't even know if she wanted to continue on. She was 11 and was just saying, I don't know if I want to live, Mom, this is hard. And it was a hard thing to hear, especially after everything we had gone through to get her where she was. But she's just struggled with a dark place since treatment. Like I mentioned, she has her hearing aids now. She struggles with hearing. She has a full-size brace that she wears now, that she wears 18 hours a day to correct the spine from.
They think the scar tissue from the surgery along her spine didn't allow the inside part of her spine to expand while she grew, so she had a large hump on her back. So now this brace is to straighten her out in hopes that these last few years of her growth, it'll correct itself. And thankfully, so far it is. They're seeing promising results. So, but obviously this is very uncomfortable. Middle schoolers aren't the nicest kids, so having a brace on is tough. It's like she said, people think, oh, treatment's over? Oh, great, good for you. Let me give you a rundown of the next 2 weeks. Had one appointment today, have 3 tomorrow, and 1 on the next 3 days. So we have trips to the hospital or a specialist every day this week. Next week, we have a video visit with another specialist, and then we travel to San Diego for another specialist, all within 2 weeks. And this is our normal. This week is a little extreme. We are on our 1-year follow-up scans right now. So there are some more this week, but she has at least 5 to 6 appointments a month.
Yeah. But it's important to be candid about these things, because I think that some folks might say, well, why are you sharing these most personal, most vulnerable moments, most behind the scene moments of your daughter's treatment? And it's important. It's not because we want to put it out there and put our daughter on display. We feel like it's important for people to know. Promoting childhood cancer awareness to us is not just blurting out statistics. It's not showing you photos of our bald child. It's more than that. And this is our story. This is her story. And it includes mental health now. It's such a strong part of this process at this point. I've looked everywhere for a service dog for Tali, and she falls in a unique category where they're not so available. And if you're willing to pay $20, $30, $60,000 for a dog, you can find one, but especially in these times, that's not very practical. But I would do anything for her. I would travel anywhere for her. I would do anything to help these feelings or thoughts or struggles. So that's a part of it that it doesn't have very much, it's not talked about very much, and it's a struggle, especially as parents. I think there have been times, like you mentioned before, where we put on a strong face and we cry in the shower, in our car, in the parking lot, in
bathroom stall at work.
Anywhere that we can have some privacy and let it out for a little while. And those feelings don't go away when you have scans. It feels just as real as when things are first starting.
It's been one of the most emotional weeks in a while.
Yeah.
For me.
You don't know if it's going to come back. You don't wish for it to come back, but you want to be prepared if it does. You don't want to be blindsided, and there's always that chance or possibility,
Right, and I'm sorry to interrupt, and we live in this day-to-day that we don't know what tomorrow's going to bring, that we don't know. I mean, you can't even go to sleep comfortably because, I don't know, something might happen. And it's unfortunate. Our children shouldn't have to go through this. They should be regular children. They should be able to attend school, maybe not now with the whole COVID thing, but they should just be allowed to be children. And it's just difficult. And that's what I want. That's why I created this, because I want to share this with other people, with other parents that are going through the same thing, or parents that have no clue what's going on, and make them aware of all of this. I do have two questions for you. Number one, if you don't mind telling us, briefly where we are in the roadmap right now as far as your treatment, what is possibly next, and another thing that I want to touch on that is, who's that? Is that our little
Tali?
Tali, hi, baby girl.
Hi.
Wow. Thank you so much for joining us. And I had the pleasure of talking to you right before we went live or started recording. But I want to tell you here publicly, little angel, that you have a whole team behind you. You do have your parents, you have the nurses, doctors, you have family, but you have thousands of family members, aunts, uncles, little sisters, little brothers everywhere that are behind you. And we see that beautiful smiling face. And why don't you give us a couple of words? Tell us a couple of words.
I don't know. What do you want to tell people, kids that are in your position, or people who don't understand the childhood cancer journey?
You don't have to. It's
You
okay.
don't have to.
We're almost done, okay? Give us like 20 more minutes. Okay? Go ahead. Go ahead, Rosie.
Bye.
Bye.
Wow.
These are our normal now, and I mean, it doesn't compare to what you've gone through, and we understand that. Everything is scary, and missing out and having our children robbed of their future, cheated out of their future and significant moments of their life is something that I won't ever understand. It hurts. So thank you for the opportunity of letting us tell our story. I know that our story can't even remotely compare, and we don't want to. Everyone's different. Everyone has different outcomes, different journeys, different struggles and triumphs. But thank you for letting us be a part of yours. And thank you for letting us help get cancer awareness out there. It's important.
Yeah, it's very important for people to know about this, and we're one big family. We're one huge family here, with family members all over the world, especially our small community of neuroblastoma. But with all these kids that are going through that, so um, just thank you for bringing that up. Thank you for speaking about her. So before we finish, I want to see if each one of you can give us some last words. Gabe, I know it's different. It's not really different, but again, I want to give a father's perspective also on all of this. I want to let other dads, other fathers know that it's okay to cry. It's okay because we are fathers, we are human. So um, if you can just touch a little bit, just quickly on that, if you guys can give us any last words, and also if there's any foundations or if there's anything that you guys are a part of, even if you guys have, I don't know, a GoFundMe or something that will help, because I know it's difficult for you guys to be going back and forth to different places, and now even going to San Diego. I know that's difficult as well. So if you have a Facebook page, I know you do have a Facebook page, Instagram, and I just want to, if you guys can just share all of that. I'll get the information later and put it in the description on the links, so people can go ahead and do that. But if each one of you can just give all of us some last words here, appreciate it.
So it's always hard to show emotion, but I found it's important for Tolly to see my emotions. Maybe not all of it, of course, but I didn't want her to think she always had to be strong. And I know some people will think this weird, but I encouraged her to drop an F-bomb every once in a while. I told her, yell to the top of your lungs. She wouldn't. She's a good girl, but she needed to get it out. We cried together several times. And you have to. Whatever gets you through that day, you got to do, so you move on to the next one. And it's hard. And as a cancer parent, the biggest thing is to be there for the other ones. Truly are a family. Steven Mendez, if you're watching, thank you. He's the first father that came up to me when we were on the PICU floor and said, hey, if you want to go get a coffee, you want to go talk, get away, whatever. Never got to take him up on it. Those first 2 weeks were hectic. Never truly got to get away too much, but just the offer, just being able to talk in the hallway was huge. And so I've tried doing that now, because it is meaningful. It's different talking to someone who understands. So that's huge. And that's why we do what we do. We try and hold little fundraisers. We try and support, we see another child in our community going through this. We go to their fundraisers if we can. We promote it on our Facebook page. We go to the toy runs, and, we try and do whatever we can now, because we understand so much of what it means.
We'll forever be trying our hardest to pay it forward for all of the support that we have received. But just to touch on what you said about dads, I watched this man. I watched him shave his baby's head and then shave his own. And he shaved mine.
And we did it together along with our younger daughter. We're a unit, and you just keep your family close. You rely on them. Gabe gave Talia almost every single one of her injections because I just couldn't do it. I'd break the needle, or I could flush a line, I could change the dressing, I could do blood draws, but the shots, he gave his daughter almost every single one of her shots, and she'd have bruises on her legs and her stomach and her arms, and he'd give her more shots because he knew that it meant it might help. And so I really appreciate you highlighting the involvement of dads. But
And you know what? Dads don't have to be the tough ones and go to work. We switched roles a while back because it was the best thing to do for our family. She went back to work. And she's been the tough one. And I became the stay-at-home parent. And I have such a huge appreciation for what she did that first year, because arguably I had the easier part of treatment at home with Tali on my own compared to what the two of you went through. And you'd have no idea how hard that role is until you're in it. And it's tough, but you do whatever you have to do, whatever's best for your family.
yeah, you see crazy things like on your video from last Sunday. They talked about the line coming loose and blood splattering everywhere. Well, that happened to Tali. She got up to use the restroom one night, and we were admitted at that time, luckily. But she got up to go to the bathroom, and there was blood everywhere. And she said, "Mom, why am I bleeding?" And her line had come off, and it was so scary because not only was she bleeding out, this life-saving medicine was also all over the floor. It was all over her shirt. It was everywhere. And
plus it's an infection risk.
It's an infection risk.
Direct line to her heart.
So the nurse said, well, we don't have a choice. We have to get a new line in there, or a new access. And it was 2:30 in the morning, and they were sticking a 1-inch needle. She had 2 access points, so they poked her twice, got her dressed up, and I know how it feels to be that terrified of things like that. There's so much more to it. This really even just barely scratches the surface of the journey. There's photos we have never shared of things we've seen. There's things that we've been present for and felt and heard and saw that, I mean, there's a lot. And our intentions with participating in any type of cancer awareness platform is just to let folks know this is the real side. We're being vulnerable. We're letting you into our home and into our lives, and letting you know that these journeys, like you said, they're not rare. There's been, just since the start of lockdowns for COVID, there's been so many new diagnoses at our local hospital, and it's happening every day, all the time, all around the world.
During a pandemic.
Yeah.
It's never easy,
Cancer.
but I can't imagine starting this during a pandemic.
Cancer doesn't care if you're rich or you're poor or you have the funds to pay your bills while you're going through treatment. These treatments are not cheap. These medications are not cheap. Those shots that I said he gave our daughter for the pack that we needed was at least $500 just per
Around.
per round. These costs are crazy. We need funding, we need cures, we need less toxicity. We need people to reach out to get these trials funded, get more resources. We need to make changes for our children. We need to give them better options and better quality of life, higher survival rates. It's our job to do that for them now. And hopefully this helps that.
So you asked about charities and things.
Yes. There you go. There it is.
This is super important to our family. When we were in treatment in Colorado for Tali, if you follow our page, Team Taliana, you'll see lots of hype, I guess is, I don't know, better word to use about this plate. We are so passionate about it because it was her idea. She saw that we didn't have a plate to honor these little warriors, these little angels, these kids, and she wanted to change that. And so
she saw one in Colorado in the parking lot, and she said, "How come we don't have one?"
Yeah.
Well, I don't know. Let's find out.
So we worked with our local representative, and these colors down here for where it says childhood cancer awareness is to represent all of the different cancers, because there are so many. It's the New Mexico sunset and the Zia. And we snuck in a little purple heart there for our neuroblastoma warriors. But we hope that when these kids are driving with their parents, or as they get older, they see these driving around town, and that it gives them hope, and it lets them know that they have supporters. It lets them know that people care. And it goes to the Department of Health. All the registration profits, I guess, go to funds go to the Department of Health. And
it's a $40 annual registration fee, and it's to go towards childhood cancer awareness, education, and outreach, I believe are the exact words. So our local hospital, your local hospital, they can reach out to the Department of Health and say, "Hey, our oncologists need to go get recertified. Can we use some of these funds?" Sure. It's September and Childhood Cancer Awareness Month. Can we do an awareness banner with some of these funds? Sure. So it was a way to spread it among the state of whoever needed that money. And that way they're not having to reach into their own funds to do it. So
we were hoping that it would help the children's cancer community as a whole and give back on a larger scale than we could even imagine. I would love to start a foundation and run with it, but it's just not in my spirit. I don't know.
Not yet.
I don't have it.
I'm not canceling it out yet.
My heart is still hurting a lot, and I wish I could have the strength to go on the journey that you are on right now. I wish I knew what to do. I wish I had some purpose, but we're just two regular folks, and we're just trying to help these kids. So we don't get any of the profits. We don't receive any money from it. It all goes back to the kids, the family, the people that take care of them, like he mentioned, the nurses. It was a way for everyone to be able to use these funds for childhood cancer awareness. There's lots of places that will cover things when you're going through the journey, such as bills, gas, food, things, small things that you need help with. But this was our way to give back on a bigger level. So if you live in the state of New Mexico, please consider a specialty plate and support these warriors and these heroes, these fighters, these angels, however you refer to them, however is the most meaningful or most special to you. Please support them, not just in this way, but if you know somebody, educate them, tell them that this is not rare. Educate them about the side effects, the things that you should look for. Educate them to trust your gut and keep pushing and question everything, because a lot of these cancers are diagnosed at stage 4 because of the fact that these smaller symptoms are just
ignored or brushed off, or
yeah. And so yeah, I don't know, we'll talk your ear off all night long if you give us the opportunity. So you know, if you have any questions, reach out to us. If we can help you in any way, whether it's if you want to just chat, if you want to understand better, we don't care if it's the middle of the night. We're open to anything.
we're both blunt and honest. So if you need the blunt, honest answer to something, and it's treatment related, or if it's post-treatment related, or anything, we'll give it to you.
You need to vent, whatever, we're here. So parents, feel free to reach out to us if you can connect on any level. Please reach out to either one of us. We have Instagram, we have Facebook, we have the Team Taliana page, and you don't have to do this alone. We're here.
Well, thank you all. Thank you both very much. And let me just say something before we end. You said something that along the lines that you were just regular parents. No, you're not regular parents. It takes very special people to be able to parent these warriors. So it takes very special parents to parent a superhero like our kids are. So trust me, you guys are not just regular parents. You guys are superhero parents. So I just wanted to put that out there and just say thank you. Thank you so much for that. So again, just thank you for sharing your story. I know it's difficult to relive these things, but I know in a way it's also part of the healing process, and it's encouraging other parents that are going through the same thing and helping out so many parents out there. And that's why I wanted to create this family here, the Gold Corner, because it's just, I've become very passionate about this, about spreading childhood cancer awareness, and you know, having this platform, it really helps a lot. And speaking to you know, superhero parents like you, it helps out so much. So I just thank you very much. Thank you from the bottom of my heart, and I look forward to meeting you all in person. You know, we're a big family here. We're such a big family here, and thank you for everything that you're doing. So I just want to thank everybody who tuned in to watch this, and I'm going to be putting all the links to their Facebook page, their personal Facebook page, the Team Taliana page, and all the other links that they have. I'm going to go ahead and put them out. And just like they said, if you need to reach out, I know at 2 in the morning, 3 in the morning, sometimes I just want to speak to somebody that'll understand, and having that support right there, it really means a lot. So I'm going to be putting their information, and just reach out to them if you have any questions, even if you just want to give them some words of encouragement. Any little words of encouragement that I have right now really mean a lot. And just know that little Tali is still fighting, and she does have a little sister. So, you know, they're affected as well, because it's all a part of the family. So they are going through a rough time as well. And so just reach out to this beautiful family here in Rio Rancho, New Mexico. They will be more than happy to lend an ear or to give advice or even cry with you, if they need to. So just thank you very much. And you guys have a brother here, and I noticed earlier you do have an Isotopes shirt, and I have a Chihuahuas hat. There's a rivalry there, but we'll put that aside right now because
Oh, thank you.
As long as they're not a Cowboys fan, it's all good.
I think I'm going to end the video now because I am a Cowboys fan. So yeah, that would be a totally different meeting at that point right there. But thank you all. Again, I did ask you for very last words, but just something very quick right before we leave. What do you guys have for us?
If you see an oncology nurse, social worker, doctor,
nurse navigator, support staff,
say thank you.
child life, say thank you. I mean,
If they're at lunch and you see them, secretly buy their lunch. Anything to do to support these people, because they are so special.
they are very exceptional, folks.
I hear it everywhere. They immediately take you in like family. And ours has. Ours is our family now.
Yeah, our home hospital means so much to us. And, there are some that we didn't love. I am guilty of being fussy with lots of positions, so sorry. But I'm a mama bear first, and, that's just what it is. I'm not sorry for that any single day of my life. My children are my priority, and so I would say advice would just be
day by day,
even minute by minute,
Yeah.
hour by hour, just keep trying it.
and enjoy those breaks, those
Enjoy the break
moments of clarity,
and
just-
hug your children, kiss them, let them know you love them, tell them every day. Don't take for granted any moments, even when they're stressing you out or when they are a handful, or
on your phone too much,
running
texting.
around during quarantine. I mean, any moment could be, could be, your whole life could be changed.
Yeah.
So just really take the time to be present.
There you go. Thank you guys for that. Again, thank you very much for the story. All the information. Big hug. There you go. Thank you for all the information on how to reach this beautiful family is going to be in the description. Thank you all for subscribing and share these stories. Please share them, and let's make these stories go viral because people need to hear this. So once again, thank you very much. Thank you for visiting the Gold Corner, the real warriors, the real heroes, and until next time. Thank you very much. God bless you guys.
Thank you.
You too.